Italy has lost more people to coronavirus than any other country in the world. Their individual names risk being overlooked, lost in the ever-changing statistics of this pandemic. But at noon, in cities and towns across Italy, every single one of them was remembered. Local mayors stood on the steps of their town halls in a minute's silence. It was an emotional gesture of solidarity, an expression of tribute, and an indication of hope.
All
the mayors have gathered together in a kind of hug, most importantly near the places that are suffering the most, where the virus has been strongest, near the grief for people who have died. It is a sign of respect to their families and their small or big communities. We are giving a message of hope.
In the bleak Madrid rain, Spain's gravediggers are going about their task with grim purpose. The virus claimed another 849 lives here in the previous 24 hours. Lockdown means the burials are lonely and heartbreakingly brief. Efforts to combat the virus and save as many lives as possible increase by the day. This conference centre in Madrid, one of several such venues across Europe, being converted to ease the pressure on overcrowded hospitals. The French president has visited a face mask factory in western France. Shortages of masks and protective gowns have left medical staff exposed to the virus. With the global market struggling to meet demand, the president wants self-sufficiency.
Avant la crise, nous produisions en France.
Before the crisis, we were producing 3.3 million masks per week. By the end of April, it will be more than 10 million, meaning we have tripled our production in just a few weeks. And we will continue these efforts to increase our production capacity so that by the end of the year, we will have full independence in producing the masks and not need to rely on other countries.
The virus is also proving a challenge to the European Union's democratic principles. On Monday, the Hungarian Parliament granted Prime Minister Viktor Orbán sweeping emergency powers to rule by decree without any time limit. In Brussels on Tuesday, the European Commission President, Ursula von der Leyen, expressed grave concern in a statement read out by her spokesman.
Any emergency measures must be limited to what is necessary and strictly proportionate. They must not last indefinitely. Moreover, governments must make sure that such measures are subject to regular scrutiny.
Coronavirus has changed what might be considered normal. There is nothing normal about Europe's streets being deserted, about shops being closed, about millions staying at home. One day, tourists will return to the Terrasse de Fêcheray and enjoy the panorama across Paris to the Eiffel Tower. For now, though, the disinfecting squads barely glance at the view. In the effort to combat the virus, there is no such time to waste. Paul Brennan, Al Jazeera.
Well, we have reporters following the story across Europe. In a moment, we'll speak to Francesco Giampatoni, who's in Milan. But first, let's talk to Marta Herrero in Madrid in Spain. And Marta, the figures are, I'm afraid, bleak. Do fill us in on the latest.
Yes, if we see the evolution of the number of infections in Spain in the past 3 days, we went from a 13.7% down to a 9.3%. It was just yesterday. But today figures have changed, and we have 9,200 new cases of coronavirus out of 94,000 cases of people that have tested positive of COVID-19. The death toll today has reached 8,100, with again over 800 people, 849 more dead. And this is the worst daily total so far. Health Ministry authorities say that the upturn in today's figures might be due to the weekend effect, but people are not relying on that because everything is very, very uncertain.
Right, and resources, of course, because of that, getting stretched and stretched more and more by the day. But there is news, I understand, of new equipment arriving from overseas.
Yes, yesterday and today we have been receiving planes with a lot of equipment from China. We've received masks, ventilators, and this might help a little bit to the healthcare workers that in Spain right now represent around 13-14% of the total of people infected from COVID-19 in Spain. So these people are in a very vulnerable situation. They're battling against coronavirus in the hospitals, and they haven't got the proper equipment. They don't have any kind of safety conditions in order to attend all these patients. They even have, nurses and doctors even have symptoms, and there are no test kits available for them to know if they're positive or not. They still go to the hospitals, they still go back home, and they could be spreading the coronavirus. So the situation for them is really vulnerable. They have been struggling. They have been claiming the government to supply immediately all the material, all the equipment they need, and hopefully we start getting a little bit of it, but still they have to deliver it to the rest of the country. They have to deliver it nationwide. So we're better, but we don't know still how good we are. So these people, the doctors and nurses, we always pay tribute to them at 8 o'clock, at 18 GMT. We pay a tribute. We go out to the balconies, to the windows. We start clapping. Everyone goes out to the windows, even the police that are in the city trying to control the lockdown. They put the sirens on, so we pay a tribute, but they are saying they don't want to be heroes, they don't want to be martyrs anymore. They just want to develop their work in proper conditions, and the conditions they're doing their work right now, it's terrible. Hospitals are overwhelmed, emergency units cannot cope anymore. They're starting to think about the possibility of transporting patients from one region of Spain to the other. Madrid has become the epicenter of the pandemic since the outbreak of coronavirus, and they cannot cope anymore. We've seen how the army is transporting corpses. Yesterday, transported 124 corpses to this ice rink they set up as a funeral home. So the situation in Spain is really, really grim.
It certainly is, Marta. Thanks very much anyway for that update. Marta Herrero talking to us from Madrid. Let's move on to Italy. We can get more on what's happening there. We can speak to Francesco Giambertoni, who's in Milan. And Francesco, Italy, of course, the hardest hit country in the world. And we have yet another huge death toll.
Yeah, the new figures show anyway a stabilized trend in the country, at least. 837 people died today. It's a little bit more than yesterday. The total death toll is now over 12,400. The confirmed positive cases are more than 105,000, but the growth is much slower than last week. That's the good news. And the recovered have never been so many. So they are now almost 16,000. There is a glimmer of hope. According to the latest forecasts based on different researches, Italy could reach the peak in 7 to 10 days and see the new cases hitting the zero in the first half of May. But as you can imagine, we're not even in April yet, so it's a very long way to go.
And Francesco, away from the intense pressures on the hospitals and the health workers and so forth, is the intense pressure on individuals around the country just struggling to deal with this, the worry and the fear of contagion and so forth.
Yeah, not just here in Lombardy, but especially here, because here the lockdown has started 3 days before the national lockdown. So a new law decree expected in a couple of days will probably extend the measures in the whole country up to the 18th of April, so for 2 weeks more. The public opinion is wondering now what's next. It's been 21 days since the beginning of the national lockdown, and it's not clear if the government is working on any other plan than the restrictions of movement and the support of the health system that, of course, is much needed now. But the authorities know that social isolation is challenging the mental resistance of Italians. That's why the regions are offering free services of psychological health support now. And the Interior Ministry has also allowed parents to take children for short walks close to home, because this situation is starting to be really unsustainable. The national TV and radio channels will broadcast tonight a big concert, sort of live aid, with musicians playing and singing from their homes, of course, not all together, with the aim of raising funds for the health system and to relieve the troubles of the people stuck at home.
Right, rallying to the cause there in Italy. Francesco Giambertoni, we do appreciate that. Thanks very much. Let's speak now to Marco Giacetti, who's president of the Policlinico Hospital in Milan. He says they've been building Italy's largest intensive care facility dedicated to treating about 200 coronavirus patients.
It's not a proper field hospital, it's a real proper hospital that will hold up to 208 persons. And it has been built in the city of Milan with the great effort of our region, Lombardy, and it's in the pavilion of Milano Fair, and we will take care of this new hospital in town, and it will be the biggest intensive care pavilion in Italy. And we've been under really, really high pressure until 10 days ago when this hospital was thought. And so we began to build it. In 10 days, we have all these 53 first places in a real hospital, as I said before. And you can imagine that in Lombardy, we have more than 6,500 deaths and 41,000 people infected.